maybe you can take us through this. So the one we're looking at on our right is the older skin, and the one on the left is the younger skin.
We're born with all the elastic fibers we're going to have, and the half-life of elastic fibers is like 72 years. So we only have 2% elastic fibers in our body. Collagen, the average half-life of a collagen fiber is like 35 years, but we produce less and less collagen as we get older. We also produce less of that. Hyaluronic acid is really the stuff where everything sits, where the collagen fibers are, where all the nutrients are for the skin, and that is also becomes, you know, less thick as we get older. And the skin, the turnover rate of the cells of the skin start to decrease, and little by little we produce less and less cells that, you know, at the surface. So everything besides all the stuff we just discussed about the skin is also mimicked in the undersurface, where the fat is, the bone, the muscles. It's terrible. Gotcha.
Yeah, so basically what you were saying earlier, I know that we took the graphic out, but the collagen, it actually, when you do the frequency on it, it makes some more collagen?
It forces your body to make collagen when it doesn't feel like it anymore. It really is a way to not look so old. How long does this last? You know, that's a question that people always have.
It was coming.
When you do radiofrequency, when we first started doing radiofrequency, I had to give a lecture about the longevity of the procedure. I had no idea. So I called one of my patients that I had done her procedure 3 years before, and I took a photograph of her. And that's what I took to my lecture. She still looked better than the day that she walked in the door. So we looked at 50 patients that had radiofrequency and radiofrequency only, because once you start getting cosmetic procedures, you get excited and you start wanting to do more things. So people that only had radiofrequency, 50 of them, about a year and a half later, 70% of those patients still felt that they had some benefit left. We showed the same photographs to doctors. 91% of doctors thought that their patients still looked good. But what the doctor thinks doesn't really matter. It's really what the patient says.
Exactly.
And so you have a pretty good chance of looking good or feeling as though your procedure continues to do you justice,
right.
Maybe about a year and a half later.
Right.